Doctors who have given a second opinion diagnosis. What is the worst first opinion you have ever encountered? This is the opposite answer, but the best request for a second opinion came from a CVS Minute Clinic. Young healthy law student goes to Minute Clinic, has the flu. This was a few years ago. No Rona, feels awful. They check him out. Yup, he has a fever, aches, sore throat. It's the flu. Flu swab positive. His clinic vitals were notable for a heart rate of 140, a bit high but not crazy high. Reassuring numbers 100. The guy otherwise walked into the CVS, and as a young healthy guy, would have been pretty easy to dismiss. Anyway, the Minute Clinic says go to the you need an EKG, so the guy follows orders. Chief complaint is I have the flu and CVS told me to come here. Get an EKG and he's in slow VT, which is a life-threatening arrhythmia that you have to be shocked out of. They take a look at his heart and it was giant and barely moving. He had an insane myocarditis. Dude ended up getting cannulated for ECMO with an hour's cardiac bypass machines as life support. I can't say all Minute Clinics are the same, but holy shit, that was a great save. I am a gynecologist. The number of times I have seen patients pregnant and upset or happy because some other doctor told them they cannot get pregnant so they did not use birth control is appalling. Usually it is family med, not ragging on all FM docs. Just how it goes. I then have to explain that even if the patient has whatever condition that makes it unlikely for them to get pregnant, the odds are almost never 0%, maybe 1%, but still not 0, so of course it can happen. I am a surgeon. Most patients come to me after having seen another physician who has diagnosed them with something and told the patient to see a surgeon. I've been called to see more than one patient for appendicitis, who has already had an appendectomy. I've also been called in multiple cases for patients who very obviously have previously undiscovered, very advanced cancer. It always too far advanced for me to be of help. So I have to wonder, am I being called so I can be the bad guy and explain everything? Yes, the answer is yes. I saw a young Aboriginal girl with Sydenham's Coriolanca, a condition that guarantees you've had acute rheumatic fever. ARF is really common in Australian Indigenous peoples, and in the long run it causes cardiac valve dysfunction and death. It's also really easily treatable by a specific antibiotic regime, although you do have to stay on it for years. The first doctor had told her it was anxiety and she just needed to sit still. Not a doctor. This happened to my mom like 20 years ago. I believe she was close to 36 at the time and had 6 kids. My mom was having severe abdominal pain, and if my mom admits to being in pain, then you know it's bad. Her family doctor was on vacation, and so my dad took her to Emerg. Doc told her she was constipated and sent her home. The pain got worse, and so she went back to Emerg a couple days later. She specifically asked the doctor, the same one from the previous time, if it could be an ectopic pregnancy. He laughed at her and sent her home. She ended up in Emerg a third time and got the same stupid doctor who accused her of lying to get drugs. She had to wait a week until her family doctor came back. Just over the phone the family doctor could tell something was wrong and told my mom that she wanted to see her first thing in the morning for tests. Mom didn't make that appointment because during the night her fallopian tube ruptured and my dad found her unconscious on the floor downstairs. He rushed her to the hospital and they found out that she was something like 10 weeks along with an ectopic pregnancy. Our family doctor apparently was screaming at the other doctor in the hallway because of his incompetence. Well, when I first started feeling sick the October of one year at college, I had a non-productive cough, night sweats and trouble sleeping, and I had lost some weight. The school nurse gave me Claritin. All of those symptoms got worse. Plus I was incredibly fatigued, my lymph nodes swelled up, and I had pretty bad backaches. My GP took a chest x-ray and prescribed antibiotics for pneumonia. At this point I had almost failed out of school because I was only managing an hour or 2 of sleep per night. It took until spring break for me to go see a pulmonary specialist. He could instantly tell that it was not pneumonia. I had stage 4B Hodgkin's lymphoma. My first PET scan showed cancerous cells and lymph nodes in all 4 quadrants of my body. At this point I had lost about a third of my body weight. The cough, weight loss, and back pain were my swollen lymph nodes pressing on my lungs, stomach, and my back. They gave me my first round of chemo and I genuinely felt incredible. I felt like such shit that in 4 mixture of carefully measured toxins was an improvement. I went home and ate a whole pizza. Chemo got shittier but it worked, so I guess I can not complain too much. Not me but my mom. She was always exhausted. The type of exhaustion that she'd have a bath, be so tired from it, she'd sleep on the bath mat when she got out. Went to her doctor, told her, "Oh, you are just depressed, go get a haircut." She did. Still exhausted, went back to the doctor, continued to tell her she's just depressed, get a hobby, it's all in her head, etc. Never sent her for blood work, never referred her to any specialist. Months later she goes back. Her doctor is on vacation. Physician reliving her doctor takes one look at her eyes and says, "It's your liver. Get these blood tests now." Abnormal blood work and a liver biopsy later. She was told she had autoimmune hepatitis and was 3 months from death. After she improved with medications, she went back to the original doctor and said, "I didn't need a haircut." 27 years later she still suffers from lingering effects. Nurse here. I cared for a woman who had been diagnosed with broken vertebrae. She was in a lot of pain, couldn't get her pain under control, and her blood pressure was very low. She'd lose consciousness and be very difficult to wake. I also couldn't get her doctor to answer the phone middle of the night. Something just felt off about the whole situation. He finally answered and demanded we Narcan her, insisting we'd overdosed her on narcotics following his orders. I then had a hysterical woman in a lot of pain going in and out of consciousness. I finally walked down to the entrance of the hospital and grabbed the cardiologist who came in at 4:30 am for rounds and said, "This isn't your patient but I think she's going to die." He came upstairs with me, looked at her and her chart, grabbed the bed and rolled her to a coup himself. I have no idea how the conversation went between the cardiologist and her doctor. She didn't have a broken back, she had an aortic aneurysm, which caused the pain and the low pressure, and the loss of consciousness. She died the next day. Doctors, if the nurse says something is wrong you might want to lay your eyes on the patient rather than shouting orders through the phone. I have one that happened to me. I did college gymnastics. My senior year one had an accident in practice landing in my neck. Went to the hospital, got x-rays, was told I was perfectly fine, walked around in pain for a while. Weeks later went to another doc, got a new set of images. My neck was broken in 3 places and had a dislocation. Had a multi-level fusion surgery days later. Found out my X-stays got swapped with someone else's in the ER and I was originally diagnosed based on someone else's images. This was found out when I went to get my records long after my surgery for insurance purposes and my files had someone else's medical records and images in it. Because of the time I spent walking around with it I had to have a posterior surgery instead of anterior, which is way more invasive and gives me major issues to this day. I am a lawyer, but had a client given a devastating diagnosis of an extremely rare heart condition. Doctor told him he had 6 weeks to live. He contacted me to make his will and set his affairs in order. Thankfully, he sought a second opinion with an extremely well-known cardiologist. I guess the cardiologist was intrigued due to the rare nature of this heart condition. There was nothing wrong with him. He was fine. This poor guy and his family were tortured over this. So devastated and terrified. For nothing, he actually called me to tell me all of this. He seemed to be still in the joyous, "I am not going to die" stage. But I imagine anger comes at some point, when you take stock of what you went through. I don't know how a doctor ducks up that massively, or if somehow my client's results were mixed up with someone else's, and some poor bastard's number is almost up and they don't even know it. Not a doctor. My sister was about 2 weeks away from giving birth when she suddenly started feeling excruciating pain and vomiting. I called her midwife who refused to speak with me despite my sister clearly not capable of speaking as she sat on the floor next to the toilet, crying and puking. Finally she just took the phone and was told by her midwife that it was probably just a virus and to eat a popsicle. Eventually I was able to convince her to go to the ER. She was immediately rushed in the OR for an emergency C-section. Her placenta had abrupted and my niece was born not breathing. suffered several seizures and even died and then was resuscitated. She is now 15 and has cerebral palsy due to going so long without the oxygen she needed. Edit changed doctor to midwife. Like many, not a doctor but just screwed over by many, got an infected hangnail, so I went to urgent care. I got a shot of an antibiotic, a prescription for another. Took the pill for about a week out of the 10-day dose. On that 7-day mark I was in my chemistry class, which was at the end of the day, feeling extremely lightheaded, tired, and so dizzy I could barely see. I staggered down the stairs of my HS to see the nurse, but she was out to lunch. I didn't know what to do and had bad attendance due to chronic illness, so I stayed for the next class. Went home on the bus and passed out on my couch. For the next 2 days I had a bunch of symptoms. I spiked a fever of 104F, had a swollen lumpy throat, in and out of consciousness, vomiting, coughing, and dizziness so bad I could not stand. Went in the next night after coming home from school with a fever of 104. Urgent care doctor said that wasn't a treatable fever, that I had a upper respiratory virus that was also untreatable, and told me to go home and not worry. I was not allergic to the antibiotic I was taking because I was taking it for a week and had no reaction before that day. Next night felt even worse, could not keep food down, could barely breathe. Dizziness was so bad I could not get up to use the bathroom without being in severe danger of falling. There was also a rash that was going from behind my ears down to my stomach and little red blotches. Went to the ER this time. Also had a yeast infection from the med. Doctor there would not touch me. He barely wanted to look at me. He would not do any kind of exam on me besides look at the rash on my stomach. He said it was measles. Gave me nothing for that. Said there was no way I was allergic to the antibiotic. Sent me home. Went the next day to see my primary doc, who squeezed me in due to my symptoms. Talked to the assistant getting my vitals and symptoms about what was going on. She said I was allergic to the antibiotic. She wrote in my chart that I was not supposed to take it. A nurse practitioner came in and listened to me tale of woe. He said I was having a bad reaction and also wrote again that I should stay away from the antibiotic. He said I could have died and usually would have because it built up in my system and caused a deadly reaction. Doc comes in and says the same thing. If I take it again I will probably die. Not measles, not an untreatable upper respiratory virus. Not a doctor. This happened to my mom. My dad had dementia and was basically non-verbal except saying my mom's name. He called me, we had all the big buttons programmed with my number, and said my mom's name over and over while sobbing. I assumed they were having an emergency, so I called 911 and asked them to make sure they took dad with them if mom had to go to the hospital. Then I headed over to their side of town. The paramedics called and told me what hospital. I got there and they were discharging my mom, who could not speak or stand up. Dad was running around like a scared toddler. The staff were telling me the ER was not respite care and I could not send my parents there when I needed a break. I told them she was walking and talking and driving the day before. So clearly something was really wrong, and I guess we had have to call an ambulance to take her to another hospital. They decided to run some tests and figured out she had sepsis. She was in their ICU a couple weeks. I just left a practice partly because a woman brought her 8-month-old in for a second opinion. The practice owner had seen the rapidly enlarging sacral soft tissue mass which the mother first noticed about 6 weeks prior. He told her not to worry about it. I checked his notes, which read, "Plan ignore." I was shocked. There was a new onset rapidly enlarging blue-purple cystic mass on a baby's sacrum. It looked like a small plum under the skin at the top of her bum crack, and without any investigation my colleague dismissed it. I was appalled. The mother was relieved. This wasn't the first not great judgment I'd seen, but it was one of the worst. I realized I couldn't work in a clinic where I'd be stepping on other doctors' toes and couldn't trust their judgment. The babies had imaging and a referral to a pediatric surgeon, but unfortunately I don't know the outcome because I am working elsewhere now. Patient: when I was in college I went to the doctor because I was pissing razors. It progressed pretty rapidly and by the end of the week I couldn't walk or sleep. The doc asked me about my sex life and I told him the truth, that my girlfriend and I had only been with each other and together for many years. He sorta scoffed at that and told me it was likely chlamydia. had a long condescending speech about safe sex with me and sent me home. A week later my piss tests were back. Turns out I had the worst bladder infection they'd ever seen. I had to have a camera shoved up my pee hole, multiple rounds of antibiotics, and to this day I struggle to pee due to irreversible damage the infection caused. Not a doctor, but my mom went into a walk-in clinic and told the doc she had really bad headaches all the time. She was a stay-at-home mom to me 10 and my sister 6, so it was written off as stress and got a prescription for pain pills. 2 weeks later the headaches were migraines, stronger prescription and try to reduce stress. A few weeks go by and she can no longer get out of bed, throws everything up including the meds, is completely disoriented and barely alive. My dad was a truck driver so he was never home. I was taking care of me, my sister, and my mom all by myself. We go back to the doctor and this lady had the audacity to say this is the weirdest migraine case she's ever seen. Tells her to take warm baths and just keep taking the meds when she throws them up. 2 months go by and my dad came home, saw the condition of my mother who was so sick she would urinate herself, the house which was being kept up by a 10-year-old, and said he wanted a divorce. That night we found out she had stage 4 lung and brain cancer with a tumor the size of an egg pressing on her brain as well as many others scattered throughout. I still haven't forgiven that doctor for not taking my mom seriously. Edit. I figured I'd answer the questions you've been having here because I am on my phone and keep getting lost trying to reply. As far as my mom goes, she fought hard for 2 years, eventually passing in November 2010. I was 13 and my sister was 9. My dad fell out of a tree about a month after her diagnosis and shattered his heel. He became disabled because of the surgeries it required and his back. He was a monster while I was home. All I remember from my younger years was walking on eggshells, constantly being accused of things I didn't do, and being watched like a hawk 24/7. I suspect he is bipolar and has severe PTSD, but you know how older people feel about treating mental illnesses. As for us, it sucked not having our mom growing up. She talked every day about how she couldn't wait to beat cancer and leave my dad so we could all have the life we deserved. I think we turned out fairly well. I am 23, have a family, moved far away from all of those memories, and have committed to breaking cycles and loving my children the way I wish I would have been loved. I do wish I knew the DRS name now, even though I know that it wouldn't bring back my mom, make her diagnosis better, or even prevented anything. I still want to ask her if she started believing her patients. I think being a stay-at-home mom, previously poverty, woman has a lot to deal with how things went down. I wish no harm on the doctor, but I haven't forgiven her for not saying something about going to the Life is short. I learned that by watching my mom give up on every dream she had because she knew she'd die, go do scary stuff because who knows what will happen tomorrow. Told by my doctor my health issues were stress-related. The second opinion found my gallbladder was functioning at 3% and had that sucker removed a couple weeks later. What's worse is I specifically asked the first doctor about gallbladder and they assured me it could not be that. Consider subscribing if you enjoyed this video and if you want to see more of Reddit Universe.